Okay, happy Friday evening, everyone. Welcome to Trak Live, your chance to talk with the leading experts in male reproductive health. My name is Greg Sommer. I am one of the founders and also the Chief Scientific Officer at Trak Fertility. Again, Trak now available. This is an at-home test kit. Measure and track your sperm count at home. We're building awareness, education all around the topics of male reproductive health. And we're incredibly honored to be joined today by Dr. David Adamson. Dr. Adamson is one of the most esteemed pioneers in the field of fertility medicine and reproductive medicine. He is the co-founder at ARC Fertility, which we'll be talking about. He's also a practicing physician at PAMF fertility clinics of Northern California. And he has a really esteemed background, including being adjunct clinical professor at Stanford University School of Medicine. He is also a past president of the American Society of Reproductive Medicine, which is the world's largest and oldest reproductive health society, as well as being a fertility expert with the World Health Organization. So it goes on and on. Dr. Adamson, thank you so much for joining us and welcome to Trak Live.
Thanks very much for having me, Greg.
This is great. Maybe just to kick us off, I have a lot of questions for you that I'm anxious to get into, but if you could take a few minutes to introduce yourself, tell the audience a little bit about your background, and please don't hesitate to brag.
Well, thanks very much. Well, it's great to be here with you. I'm really honored to participate in your program. I'm a reproductive endocrinologist and surgeon. Came from Toronto, Canada, to Stanford University to do my fellowship. Went into practice. Saw a lot of patients over the years doing a lot of reproductive surgery and infertility work, and then about 1988 started my own IVF clinic, which had for quite a while until we merged with PAMF about 4 years ago. So I really had my career in taking care of patients with infertility problems, surgical problems, IVF, and also I've had a special interest in endometriosis. Along the way, got involved in some professional organizations and also patient support organizations. So I was on the board of Resolve for 10 years, and I'm a very big advocate for patient and consumer involvement in their own health. I think that's really, really important. And subsequent to that, ended up getting involved in international health, trying to increase access to fertility care for women and men all over the world. And in the process of doing that, I've had some involvement with the World Health Organization. Also, back in 1997, founded Advanced Reproductive Care, now known as ARC Fertility. And the purpose of doing that was to increase access to fertility medicine for people who are having infertility problems by bringing high quality medicine and financial packages that made IVF a whole lot more affordable, because often, as you know, it's not covered by insurance. So I've been very lucky to have a career doing different kinds of things and doing research and things as well. So it's great to be here with you, and I'm really happy to share whatever I might know with the folks who are on the line with us.
Well, thanks a ton. Yeah, and I want to talk about really all those things because there's a lot of interest. And we met through what you've done at ARC Fertility. But maybe first, I think I'm really interested in your perspective on fertility practice in general, since you've been practicing since the early 80s. Certainly a lot has changed in that time. But maybe something that hasn't changed all that much is men's perception. And, at Trak, we're especially interested in helping more men get engaged in their reproductive health. So as a practicing physician, what's your experience with engaging the male partner with something that, maybe isn't the easiest topic to talk about?
Well, that's really a great question, because it's absolutely true that one of the biggest problems in reproduction is that men have largely been left out of it. And part of that, unquestionably has been choice. The reality of it is that most women are a lot more involved in their reproductive health, thinking about it and whatever than guys are, although that's changing now. And I think it's really great that, Trak is trying to increase awareness of the importance of fertility to men. What's not really known by most guys is that half of infertility problems are associated with with male reproductive problems. So it's not like it's just always the woman who can't get pregnant. The guys often have a problem. And so it's very important, but it's clearly something guys don't like to talk about, right? They don't. It's something that's very personal. It's very personal for women too, but for guys, there's the ego and the macho thing, and often they sort of get their, masculinity tied up with fertility, which are clearly two really, really different things. A guy can be really masculine and a male kind of guy, but he could still have serious sperm problems, right? But they don't want to know about it, and that's pretty normal. So I think it's really important for men to, first of all, on an individual basis, be aware that reproductive health is really important. There's things they can do about it. And secondly, it's really important for them to talk with their partners when they have a partner, and they should be talking about what their long-term, family plans are going to be. And then they should get good information, and then they should talk and share that with their partners. So I think it's important for guys to get more involved and to be knowledgeable themselves, but also to be supportive of their partners.
Right. So do you think it's more effective, when you're trying to help a couple and go through treatment, do you see advantages, more effectiveness when that couple has already come in, I guess, for lack of a better term, together, versus her dragging him in to come in and get tested? What role does the communication amongst the couple play from a treatment and an outcome perspective?
Well, it's really, really critical. I mean, the first important thing to note is that when a couple are having trouble getting pregnant, it can really, really be a life crisis for them, and certainly a crisis in their relationship. Because it happens to younger people, it's often the very first major challenge they face in their relationship. And so the first thing is that the couple have to communicate with each other how they're feeling about this, and then they have to talk about what they agree on or maybe don't agree on with respect to values and what kinds of outcomes they want. Because if the couple, aren't trying to go forward on the same path, then it's really a huge problem, and it creates a lot of marital discord and unhappiness in their relationship, which can only lead to a lot of unfortunate outcomes. So it's absolutely critical for the guy to be involved. And it's important for him to be involved so that he can make the right choices for himself, but it's also important to be involved so that he can support his partner, and so the two of them together can tackle this problem. And if they do that, they'll make better decisions, they'll manage the whole process better, and they'll even be able to build strength into their relationship, as opposed to having it create really serious and sometimes permanent problems.
Yeah, absolutely. No, I totally agree. Hey, I wanted to get your perspective on something, since just last week there was a lot of news. We saw it on CNN, USA Today, NPR is covering it. Big new study comes out showing that men's sperm counts are declining, perhaps a little bit of thought. Big study looking at the last 40 years. We kind of see it as a positive, in that the more people are aware of these issues with sperm health and men's reproductive health, that can generally help the communication and awareness. Do you see any difference in your practice with couples coming in when news like that comes out about maybe some more awareness, more alarm bells going off that, hey, this could be just as much his problem as hers?
Yeah, I mean, I think that that was a very important paper that came out, certainly a big paper on a lot of studies. As you know, it's still very controversial and difficult to assess the data when you're looking at data from all over the world over 40 years. It's in very different kinds of studies. It's very hard to assess the data, but there's very real chance that there could be changes in sperm counts because of all the changes in the environment, pollutants and pesticides, not to mention hormonal compounds and drugs that are out there that many men are getting exposed to. And sometimes, lifestyle factors can change things, and whether it's, potentially smoking, other medications or other drugs, alcohol, etc. So there's a lot of things in modern society. I must mention obesity too, of course, which is very important, that could potentially be associated with a reduction in sperm count. Now, whether or not that is happening, and it probably is. I think there's a very good chance it is. What's really important is that for any one guy, he be aware of the fact that any of these factors or something that's not even related to that might be affecting him.
Right.
And so I think the benefit of these studies coming out, first of all, it's pretty good science and we need to pay attention to it. But I think the major benefit for male reproductive health is just what you said. It's to raise awareness. I mean, you know, somebody says, yeah, hey, this might be something I should pay attention to or know about, or I should get some more information on, I think is very, very positive. And so anything we can do to get more education, both for women and for men. It's not just for men, but men have clearly been further behind the 8 ball than women in terms of getting information. So I think it's a great opportunity when a study like this comes out for people to get educated. And that will only help, improve the quality of health for everybody.
Yeah, no, very well said. Education goes a long ways, and it's a big first step. So let's talk about ARC for a second, or Advanced Reproductive Care, a company you founded. And one of the issues that couples face a lot when they start looking at fertility treatments is the concern about cost, right? And fertility treatments can be very expensive and often not covered by insurance. And you started this company, correct me, 20 years ago to help address that burden and that issue that's in this space. Tell us a little bit more about ARC Fertility, what you do, and why couples who are considering fertility treatment or just asking questions should look into it.
Thanks very much for asking about that. I mean, the first thing about ARC Fertility is that we started it with a purpose of increasing access to quality infertility care all across the country. And so we have a network of physicians in about 40 states, 250 plus physicians in almost 200 locations around the country. And they've all committed to providing, high quality care. And that's the most important thing, a network of doctors that are committed to the patient. And secondly, we put in programs we call the ARC Fertility Program, which basically amounts to packages of services that patients need, 1, 2, or 3 cycles of IVF that are at set prices, so it's predictable what the cost of things are going to be, and these prices are discounted and have some free services with them, so it makes it a good deal for the patient. And then on top of that, the patient can finance these packages so that they can make it more affordable over a period of a year or 2 or 3 years, or sometimes even longer of paying for it. And then we have some special success programs and other programs which basically amount to patients can get a refund depending on the type of program they get and what they do. So the bottom line is to make good care affordable for patients. That's been the goal since day one. We also are very committed to educating people. And so we have a website, www.arcfertility.com. And of course, we put information out there to help educate people, because we really want the folks who are going through this to be able to get good information so they can make good decisions for themselves, because every patient is different and needs a unique approach to their problem.
Right. Well, I think that's the critical piece. So for the people, and we talk to them all the time about, either they assume they can't afford it or they can't afford it. I guess the take-home message would be, that's probably not true, and very likely may not be true. And options out there like ARC Fertility can really help. And don't start with we're never going to make this happen. If your goal is to become parents, there's a lot of resources and good options out there for those people. Hey, you mentioned your role with Resolve. Maybe that's a nice lead-in. Actually, I don't think we've talked about Resolve on this series before. Could you maybe describe Resolve a little bit, and especially what patients or couples looking into fertility treatment might be able to access through Resolve?
Sure. National Resolve is the National Consumer Infertility Organization. It actually started out as a self-help group where women and couples who were having problems literally sat around a kitchen table and tried to give each other emotional support for the problems they were going through. And over the past decades, because Resolve's over 40 years old now. It's developed into a national organization, offices in Washington, and they provide, first of all, a lot of really good education about infertility. That's at resolve.org online. They also provide a lot of opportunities for people to get support by networking with others who are going through the infertility problem, and they do a lot of advocacy trying to get legislation passed to help improve insurance coverage and help people who have infertility, so trying to increase access. So Resolve does a lot of very good things. It's all volunteer, nonprofit organization. There are a few physicians on the board and whatever, but it's really run by patients and consumers and people who've really had to deal with this really difficult, disease of infertility.
I think you said it well. I think a lot of people don't even think about that infertility is a disease. And the work that you are doing at ARC and Resolve I think it's starting to really resonate, that you see an increased awareness at the public health level and amongst legislation that this is a disease and we need to treat it like a major public health issue before it turns into a major epidemic. So that's actually, so you also mentioned the World Health Organization, something that's really fascinating, that you're an expert on the panel. You've done a lot of international work. Maybe start by saying why the World Health Organization is interested in fertility. What role do they play in this field, and how have you supported that work?
Well, it's a great question, and it starts way back when the UN was founded, United Nations was founded, and in the initial charter, it calls out the fact that people have the right to found a family. And that's really the foundation of sort of the principles that came from that. And subsequent to that, of course, the World Health Organization is sort of an organization that works under the United Nations. And so out of that right to found a family from the UN Charter, the World Health Organization has statements on reproductive rights. And so, in fact, there is an international global consensus that people have reproductive rights and they do have a right to be able to have a family. Now, over the years, the hard reality of it is that for many decades in the early part of the UN and WHO, the World Health Organization, the focus was on contraception because of this huge concern about overpopulation in the world. And so, in fact, there was not a lot of attention paid to infertility for several decades at WHO for a huge number of reasons, one being that the population crunch that everybody expected hasn't really materialized. And secondly, because of a real recognition that even if countries may have a lot of people, that doesn't mean that somebody with infertility should solve a population problem by not having children. It's not necessary for one person to have no babies so somebody else can have 5 or 6 babies. And so the goal is to really have everybody have the right to have the number of babies that they want to have, that obviously they can reasonably bring into the world and take care of. And so there's a recognition that I think the social needs for population do not outweigh all the individual rights to have children. And that's a very non-trivial, I think, change in perception that's occurred over the years. And as a result of that, now at the WHO, there's been new leadership in the last several years at WHO, which has really put more focus on reproductive rights and on reproductive opportunities. So that several years ago, the WHO started a very large project to develop infertility guidelines, and they brought over 100 experts from around the world together to develop those. Those guidelines are now in the final stages of getting approval, and they'll come out, we expect, next year, and they will be sent to all the governments of the world, 197 health departments in governments around the world, and to say, what are you doing about infertility? And here are guidelines about what you could and should be doing to the extent that your country can do this. So this is going to be a very major initiative on a global basis. And secondly, The WHO now is doing some real research into the prevalence and the burden of infertility, even though we know it's very, very high. They're working to get better metrics so that we can use these in all the different countries to develop policy. And of course, the hope of all of us, this policy will also translate into economic support through health systems and insurance plans to help provide the financial wherewithal for people with infertility to get the care they need. And there's also a partnership that's developed among a number of the what are called NGOs, non-government organizations, now called non-state actors, but basically professional nonprofit organizations that are partnering now to work. We're partnering together to work with WHO to try to get a better focus to increase access and increase the quality of care. So a lot of really good things happening, and the WHO is helping to make those happen. Wow,
that's phenomenal. It's quite the undertaking. 197 countries that are going to be getting guidelines. No, that's fantastic. Thank you. Look forward to seeing how that comes out. And again, it kind of comes back to our first point about the importance of awareness and communication. And
right.
It's really, and I didn't know that the right to have a family is part of the UN Charter. You know, I say all the time that having a family is a right. It's not a privilege. But now I can actually back that up with UN Charter. That's phenomenal. So thanks. Hey, we have a question from the audience. Let me pop it up here first, and this is a great one for you. The question is, how long is the IVF process, start to finish? Dr. Adamson, what do you say?
Well, there's different ways to look at the length of time, because there's usually a bit of a consultation to start with and some tests that have to be done. And, you know, probably in almost every case, those things can be done within a few weeks' time. Sometimes there's some ovarian suppression, like with a birth control pill or other drugs, for several weeks before an IVF cycle is started. And so you put all that together, you can say maybe there's sort of a month or so of preparation. But the actual real IVF cycle, in terms of how people look at it, which is ovarian stimulation with drugs, followed by an egg retrieval, which requires minor anesthesia, and then an embryo transfer. That whole process only takes about 2.5 to 3 weeks from starting the drugs, the stimulation drugs, until even having an embryo transfer. And then, of course, it's a couple more weeks until you can do a pregnancy test and see if the patient's pregnant. So if you wanted to say, well, when I start the drugs until I know if I'm pregnant or not, it's probably in the range of 4 to 5 weeks. There's only actually about 10 or 12 days of really, really active treatment with the ovarian stimulation, monitoring, and doing an egg retrieval. So, you know, a couple of weeks or so. So it's, you know, it's a time commitment, but most of the appointments occur in the morning. Patients can keep going to work every day, and so most people can manage it. But, you know, it is a real procedure.
Yeah, no, that helps a lot. I think a lot of people think, you know, maybe this is like 6 months or a 12-month.
No, nothing like that. No, a couple of months, baby. You know, go and see a doctor. You could probably be finished the cycle in, you know, a couple of months, 3 at the outside, and the actual really intensive time again is really only, you know, 2 to 3 weeks max.
Sure. Okay, great, thanks. Along those lines, a question, since you've been, you know, practicing this space for a while, what's been some of the biggest developments since you started practicing in 1980? And then secondly, I guess, what do you think what are the big things coming down the pipe of, you know, new technologies, new treatment options? You know, where are we headed from here? So that's a two-part.
Yeah, well, the things have changed so much. I mean, the first thing is, you know, in the early parts of the career, we saw a lot of great developments with reproductive surgery, and we saw a lot of developments with ovarian stimulation. These were soon surpassed, I think, by IVF becoming so much more successful. In the early days, IVF had pregnancy rates of 5%, you know, meaning in the mid-80s. And 5%.
In other words, so if you underwent in vitro fertilization, there was about a 5% chance that you were actually going to get pregnant. Is that right?
Yeah, even for a 35-year-old woman or so, right? Wow. And now the chances are 10 times that anyway. So the laboratory technology in IVF has just been unbelievable, really, for procedure, you could argue that 10 times increase approximately in pregnancy rates over 30 years, which is really phenomenal. So that's been a huge development. Part of that that's done in the lab is intracytoplasmic sperm injection, or ICSI, or just called sperm injection, to treat really significant male fertility. So if a guy has practically no sperm, but some sperm, we can do sperm injection and get, for practical purposes, normal fertility rates and normal healthy babies. And this sperm injection has been an incredible development in terms of treating male infertility. That was huge. Another big change, of course, has been genetics and being able to do diagnostic tests on the embryo to look for disease states and other types of things. Genetics is going to be part of the future story too, but it's certainly part of the past story. So, I'd say in general, reproductive surgery, ovarian stimulation, and then dramatic lab increases in pregnancy rates, sperm injection, and genetics have been the big changes. And I think also really the societal acceptance of different ways of getting a family. When we first started, really only married heterosexual couples got treatment. That was really pretty standard. And that's just not true anymore. All sorts of alternative ways of getting a family are considered to be very appropriate and a good thing to do. And so we treat, anybody comes in as an individual, has reproductive rights, and we try to meet their needs to help them get a family the way they want to. And I think that social change has really been big too. It's really been big. As we look to the future, I think there's no question genetics is going to continue to just really grow exponentially. Big development this week about using CRISPR to change an embryo, a human embryo, and I think we're going to continue to see big developments here. We've also, in a very interesting way, because freezing of eggs and sperm has become so much better. I mean, basically, egg freezing did not work well until 5, 6, 7 years ago. And now with vitrification or ultra rapid freezing, we can actually freeze eggs. And this has opened up a whole new area of helping people reproductively, which means we can help people preserve their fertility or prevent infertility down the road by freezing eggs. And of course, we've been able to freeze sperm for a long time. So that's also very important. So not only for people undergoing disease treatment, like cancer treatments, are going to lose ovarian function or potentially lose a testicle, but for young people who are concerned for a variety of different reasons, we can look at fertility preservation. And that expands the infertility treatment into, quote, fertility care, end of quote, which is sort of reproductive care, prevention of problems, planning ahead, which is why it's so important, for the guys that are watching this, and maybe some women too, to know that they should get good information about their reproductive health so they can plan, when am I going to have a family or not, and should I take some steps now to protect my fertility? Because technologically, we can do a lot of things to help.
Right. Oh, great. But, we're going to wrap up soon, but we did have a few questions come in that actually relate to what you were describing. One of them asks whether you can do in vitro fertilization if a man isn't producing any sperm. And I think you mentioned as long as he's producing some sperm, but what are the options if a man is truly not producing sperm?
Well, there is a big difference between almost no sperm and no sperm. So if he has almost any sperm, we can get just a few sperm, then we can essentially make his fertility normal most of the time. But if a fella has zero sperm, and some guys have zero sperm, unfortunately, there's nothing we can do today to make sperm, although it's important to note that there's research going on this, and certainly in animals. Some artificial sperm have been made, and these studies are going on in humans, and there's been progress in this. Recently, there was a paper about some progress. So there's nothing that we can clinically do today for a guy who's got zero sperm, but there is a lot of research that's even getting into the human cells now with stem cells and what have you. So I think we have to continue to watch that. Now, in addition, of course, there are alternatives, which means the use of donor sperm, and that can work exceptionally well. And so we do a lot of donor sperm, and that would be the approach for a fellow who had absolutely no sperm. It's not very many guys, but there definitely are some guys who just don't make any sperm. We don't have a cure for that yet.
Sure, but of course, just because there's not a cure doesn't mean there's not options. And finding
the options can work great. Yeah.
Yeah. Hey, one last question here, kind of along those lines, I guess. The question is, what do you think about things like diet and weight loss for improving sperm count?
Well, that's a great question, and the short story here is it's very hard to look at cause and effect when you say I did this and my sperm count got better or worse or whatever, because sperm counts vary a lot anyway.
Right.
But that said, it's absolutely clear that we can state it's important for men to look after their reproductive health, and a lot of this is pretty routine stuff, right? It's like get a decent amount of sleep, sufficient exercise, have a good diet. Probably reasonable, not essential, but probably not hurtful to take a male, multivitamin with an antioxidant. You don't have to take huge doses of anything, just a good diet and, maybe a multivitamin tablet. Obviously, don't smoke. Probably not a good idea to use other social drugs. Don't drink too much. Stay away from pesticides and bad things that are, chemicals in the environment to the extent you can. Some guys have jobs where that's tough, but to the extent that they can protect themselves from environmental toxicants, it's obviously a really good idea. Some medications can be a problem. The proverbial heat is difficult to know how big a deal that is, but it's probably a good idea for guys not to cook their testicles all the time on bicycles or sitting in hot tubs for an hour a day and stuff like that, to be thoughtful about that. So good general health, not being overweight, of course, will go a long way to helping guys. And then, they can check and see if they have concerns because they've had a problem in the past, like a undescended testicle or an operation, for a hernia, or if they've had a testicular injury from something, or if they did have exposure to radiation or something, or some drugs through some chemotherapy, then obviously they should get themselves checked. They could do your test, which could be helpful as a start. And if they find anything or they have any concerns, they should definitely go to see their primary care physician and then get a referral to a urologist if necessary. So the important thing is to be aware and live well. And then if you think you got any concerns, find out some good information and then act on it. Right.
No, that's great. Nice chance for me to plug the Trak app. All the things that he was mentioning with diet, exercise, past undescended testicles. We have a questionnaire in there that you can fill out. Takes you 5 or 10 minutes, and we'll help identify things that could be causing an issue, and just to again build awareness and put it on your radar. Hey, question: since you've been practicing for a long time, I was wondering, do you keep a tally of how many babies you're up to?
Yeah, well, more or less, I know we're way over 10,000 now and counting. And,
wow.
Here at ARC, that's just in my own practice. Here at ARC, I know we've helped about 25, 30,000 couples now. So it's a lot of people. So I feel really good about that. That's, lets me sleep at night.
You put little check marks on the wall or something for everyone?
Yeah, no, I don't do that.
Well, I have two, but I can keep track of mine a little bit. Last question: what's the best part of your job?
Yeah, well, the best part of my job absolutely is the individual patients I see when we have successful outcome with a healthy baby. I wish I could say it happens to every single person. It doesn't. So really try hard to help those who don't get pregnant to resolve their situation and move on with their life, either through, donor sperm or donor egg or adoption or child-free living, help them move on. But there's no question that it's a huge reward when I meet couples and I see their kids and now they've graduated from college and things. I meet them and they're 23 or 24 and it's very rewarding. It is nice to have that happen. So that's absolutely the best part, seeing the individual people happy with their families.
I bet. Very cool. Dr. Adamson, thank you so much again for joining us. Let me just wrap up by saying you can learn more about ARC Fertility, arcfertility.com. For Trak, we're at trakfertility.com. And, for those of you who are watching maybe the stream, feel free to, upload pictures or upload your questions to our Facebook page. Dr. Adamson and I will be happy to take questions after we're done here. Again, our goal, I think, is one and the same, that we're trying to build awareness and help as many people as possible. Dr. Adamson, thank you so much, and hope you'll join us again sometime.
Thanks very much. I really enjoyed it.
All right, thanks.
Have a great week. Take care.
Thanks.
Bye now.
Bye.
Thank you.